nyo, wala na kayong ine-expect na iba?
Ma'am, meron pa rin po yung kabutabo ng Janssen, yung sa Johnson & Johnson.
Ayan, di ba meron yon?
Kaka-start pa lang po kasi ng phase 3 trials nila. So it might take baka 1 to 2 months pa po yan bago mag-apply.
1 to 2 months.
Yung pong sa Serum Institute of India, nagtanong na rin po sila sa amin at once daw po na magkaroon na sila ng enough data dun sa kanilang phase 3, yung Novavax, mag-apply na rin po sila. Pero ang target din po dyan ay baka 1 to 2 months pa from now.
Thank you. Gusto lang namin magka-idea kung ano yung mga available na pwedeng ma-approve in the near future sa ating FDA. Ngayon, ito naman kay Secretary Galvez, gusto ko itanong, di ba sinasabi mo yung COVAX ang darating sa atin early because ito yung donation ng WHO para sa mga poor and developing countries na bibigyan tayo ng 22% of our population. Tama ba yun?
Ma'am, more or less 20%, 16 to 20% of our population, considering
that so 20%
of
of the population. How do you expect them to arrive to the Philippines? Yung 20% na yun, kasi parang 40 million yun doses, di ba?
Ma'am, yung mini rollout nila, yung more or less a few thousands of volume po nila will be coming this February or first
February. Gaano karami yung February?
Ang ano po nila, mini rollout, meaning it will not be more than 200,000 po siguro. Yun po, pero wala po pong definite, ma'am, na
and then the others, how do you expect them to arrive? After this February rollout, what is your expectation on arrival?
Meron po tayong in-expect na I believe ang mga 4 brands na at least sa March meron po tayong initial few hundred thousands po. Yung po namin, in-negotiate po namin na magkaroon din po sila ng mini rollout for our healthcare workers.
Sabi mo itong February is Pfizer ang darating.
Most likely po, ma'am, dependent on the WHO.
Ano pa ba yung ibang brand ng ng COVAX?
Ang brand pa ng COVAX na naka-enlist po sa kanila is AstraZeneca, Pfizer, I believe also the Johnson & Johnson, Novavax, and also Sinovac, and the other 2 Chinese vaccine.
Sinopharm
and CanSino also apply.
Sinopharm and CanSino. So ito dadating to throughout the year, not earlier.
Ma'am, kung ano po ang available sa COVAX, but they said that some of those vaccine that will be approved by them will definitely be deployed on Q1.
Oh.
First quarter po.
First quarter, ilang % ang first quarter?
Ma'am, still not definite considering that the communications that we receive is just prepared for some volumes, particularly those who need yung tinatawag po natin ultra cold chain. And the ultra cold chain includes lang po yung Pfizer.
O ngayon, I just want to summarize yung ating dadating sa atin na idodonate natin, yung binili ng private sector, binili ng local government, at bibili ng national government. So malaman natin kung ano talaga yung total na meron na tayo. Sabi mo, 1 is yung 40 million yung COVAX, di ba, na to be donated. That's 20%, di ba?
Yes, ma'am.
40 million ang COVAX. And then sabi mo, bumili tayo yung tripartite ng 17 million AstraZeneca, di ba?
Yes, ma'am.
Yun yung order natin. Tapos, sabi mo, bumibili tayo ngayon ng yung Moderna, di ba? Na nag-order na yung private sector ng 8 million, tapos ine-expect mo 20 million, so ang government will buy 12 million. Tama ba yun?
Yes, ma'am.
And then yung bibili pa kayo ng additional na Pfizer, sabi mo 20M. Tama ba? Nagne-negotiate kayo?
Yes, it's still negotiating. We cannot.
Oo,
We cannot
pero
divulge.
if you can negotiate doon, bibili kayo ng 20 million Pfizer yung government?
Yes, ma'am. Actually, ma'am, we are requesting for higher. And hopefully, ma-approvean po yan, ma'am.
So, pag inad mo to, this is 57, 6, plus 20, 77, 97 million
Plus,
doses.
30 plus 30 to 40 million sa Novavax po, ma'am, sa Zero to India.
30 million sa Novavax. And then, that's about 127. Kulang pa. Saan manggagaling yung iba?
Another 25 for Sinovac.
Sinovac. Okay. Okay, that's 127, 152, di ba?
Yes, ma'am.
Ang target mo is
148. 148, ma'am.
So ito na yon. Ito yung planado mong bilhin that if you can buy and the government can afford this.
Yes, ma'am. It's already programmed on our 72.5 billion, ma'am.
Okay. So yun lang, and I just want to thank you for your answers. At least may idea kami na kung ano-ano yung mga brand na bibili nyo at pinagpaplano nyong bilhin. And I would like to support in the end suggestion of Senator Recto. Mukhang nagkakagulo tayo kung sino ang mauunang i-vaccinate. May suggestion si Senator Recto na why not do it by age? From matanda pababa. Kasi alam naman natin na yung matatanda ang medyo high risk, yung mga bata hindi masyadong high risk. So kung magkahirapan kayo sa pag-decide kung sino ang, of course, ang priority would be the medical frontliners. But after that, alam ko senior citizen, so yun yung pinakamatanda. So ngayon, kung yung the next batch, kung hindi tayo magkasundo, ay okay rin sa akin. It's a suggestion na we do it by age pababa. So yun lang po. Marami pong salamat. Thank you kay Senate President and thank you din sa ating mga resource person. Maraming
Thank you,
salamat.
Senator Villar. Just to find out a little bit more about 148 yung target
Yes, sir.
doses.
Yes, sir. 148.
Doses.
Excluding the COVAX. Kasi the COVAX.
Ilan ang Sinopharm dyan?
Sa Sinopharm, ongoing pa rin po, sir, yung ating negotiation.
So wala pa
po, sir, kasi we have also yung second wave procurement. We have a first wave procurement and second wave procurement po.
All right. Thank you. Next is Senator Pia Cayetano. Senator
Thank
Cayetano,
you. Thank
have 10
you,
minutes.
Mr. President. Yes, thank you. Good afternoon to everyone. I have a number of questions and also comments following up on questions of my colleagues who asked before me. Let me start with this one. No? Senate President Pro Tem Ralph Recto, in a series of questions, was asking about ensuring that the best vaccine is delivered to the frontliners. What I want to
Senator Cayetano, we lost you. Don't tell me you have the same internet provider as Senator Gordon, ha? Ayan, no? Due to low bandwidth or local computer conditions. I hope you can listen, you can hear us, Senator Cayetano, or the staff of Senator Cayetano. Please inform her. Senator Cayetano again. While Senator Cayetano is trying to get her signal back or connection, can we ask Senator Lito Lapid if he's still going to ask any questions? Ano? Online pa si Lito? Hindi na. Online but no video. Are you going to ask any questions, Senator Lito Lapid? What about Senator Bongo? Senator Bongo? Hmm?
Sir, can I make manifestation, sir?
Go ahead, Secretary Galvez.
Sir, I will just make a correction. I have already the data of the number of people have been vaccinated worldwide, globally. So I have listed here, and maybe we can see the difference on the different countries. So the global total vaccination that have been administered is 56,740,891. This is topped by the US with 18,449,281 as of January 21, followed by China with 15 million, and then EU 7,326,550. UK 5,437,284. Israel 3,208,198. EUA is 2,246,069. Germany 1,400,001,693. Italy 1,282,184. Turkey 1,127,480, and Spain 1,103,301. Based on our researcher, most of those countries in US, EU, UK, and Israel use Pfizer. That's all, Mr. Chairman. To answer the question of
Mr.
Senator
President.
Raprecto.
How about Indonesia, Singapore, Thailand, those that have reported to have started their vaccination program?
Sir, the other countries here is France, 823,000.
Medyo negligible na yung...
Wala pa po kasi hanggang 265,000 lang po yung ano po dito. So nandito lang po ang India, Russia, Canada, Poland, Mexico, Romania, Saudi Arabia, and Argentina. Argentina po, ang ginamit po niya is yung Sputnik 5.
UAE.
UAE po sir, marami po sir. Basically sir, ang ginamit po nito sir, Chinese vaccine, Sinopharm, 2,246,069.
Can you give us a copy? Mr. Senate President, can we be given a copy of that report?
Yes, ma'am, I will provide, ma'am.
All right, okay. So Senator Pia Cayetano is now online. Go ahead, Senator Cayetano, in 10 minutes. Go ahead, Senator Cayetano. You have 10 minutes.
Thank you. The whole time even your photos are coming in and out, so request my staff. Mr. President, with your permission, can I turn off my video?
Oh, sure, as long as you have an audio.
I will ask my staff to just message me if you cannot hear me kasi otherwise magmo-monologue po ako. So let me proceed. I was saying, Mr. President, earlier that follow up to the Senate Pro Temp question on statement and concern about the best vaccine being given to the frontliners and the rest of the country. Is it not a conundrum that we are faced with? Because I noticed that countries all over the world, especially those who can afford, have purchased up to 3 times more than their population. Pinakamaliit na nga yung 1.3, 1.8, no? And I'm guessing that the reason for this is because naninigurado sila that they have supplies coming from different suppliers, and maybe in 3, 6 months or 9 months from now, when there is clearer information, they would also know if they would prefer one versus another. So are we not faced with a situation where technically you may be negotiating with all 3, but later on, it's possible that you might determine that only one is really good and maybe to the exclusion of the others. Or in the meantime, one may be preferred to the others in terms of the objectives that we have, that there are less deaths, there are less transmission, whatever it is. So that's my question to the experts. I think that should be explained properly so that my colleagues and myself will also understand that situation that you are in. So what if the one that you purchased that is the first to arrive, and at the moment it arrives, it turns out that the one that's coming 6 months later is better. Those are the situations you're faced with. So how do we settle this? How do you propose to address that situation so that we are clear, so that hindi tayo nangangamba, ninenervyos, people understand that things are flowing and it's work in progress.
Ma'am, I agree with you that we have to give the best for our health workers, but the situation is like that we are only grappling for the 18% of the supply chain, meaning most countries like Canada, they have bought more than 6 to 9 times of their population. And with that, those most sought brand like Pfizer and Moderna has been bought by these countries ever since that they had started their development. So most of this brand has been bought by rich countries since May and June. So we are now in a position that we are negotiating with the different vaccine, like for example with Pfizer, Moderna, AstraZeneca, and other vaccines, which their expected delivery will be at the start of Q3 and Q4. So that's the problem right now is on how we could really explain that those countries like Turkey, Romania, UAE, Indonesia, and other countries like us, I mean Malaysia and Thailand, we have to rely on those only available vaccines that will be coming in, which have also the same efficacy as explained by our expert. So that's our problem right now. But what we are telling to the public is that these vaccines of portfolio that we will be having, for as long as it is being approved by the vaccine of expert and also be approved by the FDA for emergency use, meaning these vaccines are already safe and effective. And maybe
And WHO siguro, idagdag natin, no, Secretary, WHO also, di ba, from an international perspective.
yes,
Tama.
ma'am. Anyway, ma'am, lahat po naman po nito nag-apply din po na sa COVAX, and maybe the WHO will also tinatawag nating validation list. And maybe we can ask
Yeah.
Dr. Montoya on this aspect.
Your Honors, if I may answer the
Yes.
question. Yeah. I agree with the previous statements made by Secretary Galvez, but in addition to that, based on the current information that we have, and since we are basing it only on the available data, some of them are at the latest up to phase 2, and some of them partly phase 3 as part of the requirements for the EUA. Based on the available data, we can only work on the vaccine efficacy, which are just numbers, but we will not actually see whether they will behave the same way in the community, and we're talking now of vaccine effectivity. So based on that consideration, we consider them all as of the same benefit once they are approved by the FDA. But as more and more evidence comes out, for example, the phase 3 clinical trials, the complete data are actually released, we may be able to identify certain vaccines that are definitely better than the rest. And if that happens, then maybe we can just narrow down our choices to just one or two. But as of now, we really have to look at the different technology platforms and their advantages and disadvantages. And once they're approved by the FDA, then we will be including them in the portfolio for now. Thank you po.
Okay, I agree with your statements, and I suggest that you communicate all of this better and paulit-ulit, no? Because so people can understand. Because once na may parating kayong vaccine, and then katulad nun, di ba si Pfizer, may lumabas na statement na how many people, elderly people died, no? You have to be able to communicate that the reality is people have made their decisions. Experts in other countries and even in our country will be making decisions based on limited data. Phase 3 trial is not even complete. Diba? So I will continue to suggest that you improve your communication on that so that people understand and hindi kayo sisisihin ng basta-basta na o bakit yan ang kinuha nyo, hindi pa pala kayo sigurado. Talagang wala pang sigurado ngayon, correct? Please correct me if I'm wrong. May sigurado na ba ngayon? May natapos na bang phase 4 clinical trials which is required?
Madam Senator, wala pa pong approved product na COVID-19 vaccine sa buong mundo at this time.
Exactly. My point. So please keep reiterating that this is work in progress in the whole world, and we are basing our decisions, the decisions you are making are based on the limited facts that you have. So there was a statement also made earlier na nauna na yung ibang bansa, and I said that in the last hearing na technically maybe for the first time in a long time, sila ngayon ang guinea pigs natin, no? So we might as well take advantage of the situation. They have money, they have the technology, they rolled it out earlier than us. So we can now learn from them. So there was figures thrown out, 7 million or even more have been vaccinated. But is that enough to come to a conclusion that one is better than the other? From my humble opinion, and I am not an expert, so I will ask the answer to come from you. It's not enough because you're looking at time. What happens after 3 months? What happens after 6 months? What happens after 1 year? It's not just a matter of how many million people were vaccinated. Is that correct?
Your Honor,
May I get a
you're
response
correct,
from
because,
someone?
yeah, you're only going to make an evaluation at point in time, but you have the benefit of long-term follow-ups. That's even better.
Exactly, and that is required. That is required under normal circumstances, diba? That's the point. That's the point that you have to continually communicate with everyone from decision makers like us, policy makers, to the average Filipino who will have to make their own personal judgment if they're willing to take that vaccine or not. Hindi yung parang pag na-question, o ba't may ganon, may nagkaroon ng adverse effect, o ba't ganon, vaccinated siya, biglang nahawa yung nanay niya. That's when you don't want na magulat sila. You have to tell them that is how science works. And we're in a situation where we could not wait for the normal 2-year process to push through because we all are in a hurry also to get on with our lives. So do I make my point clear that it's really a question of communicating better because you cannot improve your situation?
Yes, ma'am.
May I get a response?
Very clear, ma'am. We understand.
Mr. President, with the permission of Senator
Yeah, I'm trying.
Senator Pia.
Of course.
Good.
Siguro kaya rin nag-uunahan kasi, di ba, a shot in the arm, shot this economy yun eh. Yun ang isang factor na kinoconsider ng authorities kasi it's not only health issue. It is also an economic issue. And when we dilly-dally, deliberately or not, maganda rin yung point ninyo na ginipig natin yung ibang bansang mayayaman pero mahuli naman tayo sa economic recovery. Yun naman ang downside. Anyway, that's just a comment, Mr. President. Thank you.
Yes, and I thank the gentleman for that comment because I totally agree with him, no? And I appreciate that you pointed out because it was not my intention to say that let's wait. But definitely that's not my intention. My intention was simply to say, katulad ng sinabi nyo, number one, we shouldn't dilly-dally. But given na huli na rin lang naman tayo dun sa top 10 countries or more of the world that can procure easily, we might as well learn from them, but in the process, explain to our people what's happening. So kung yung unang na-procure natin, kasama naman yun sa nabigyan ng emergency use, and then pagdating dito, uy, siya pala yung maraming side effects, siya pala yung medyo hindi okay, then I'm saying, ngayon pa lang, pag-isipan nyo na. What do you do then, di ba? Are we willing to throw away 1 million vaccines if it turns out na hindi pala hiyang ang Pilipino sa ganon? I don't need an answer now. But what I want is the assurance that these are processes that you're thinking of and communicating. Para kung may mangyari, hindi rin kami yung babalik sa inyo na sabihin na, ba't di nyo naisip yun? Ba't kayo nag-order niyan? Then you can explain. We had to take a risk like all the other countries in the world to procure as many different kinds that are at least at a minimum level of efficacy for our people, di ba? So we can move around. Do I make myself clear, Secretary and our resource person?
Yes, ma'am. Very clear, ma'am. We really appreciated your comments. It's really true.
Thank you. And so then I go now to elaborate on the point that Senator Lacson mentioned about the opening of the economy. So actually yesterday I was messaging Secretary Mon Lopez and Secretary Carl Chua because I know that they were in meetings with Metro Manila mayors on the opening up of the economy to allow children to go out because sabi ni Secretary Carl, we have a very young economy. And when the children cannot go out, our economy is also fizzled dahil hindi sila makaalis. So my question lang naman po is this. As we do that, as we roll that out, what is the clear guidelines that you also have to ensure that we do not end up like the countries now who have been more open than us, like in the United States, a lot of them have allowed universities to open, public schools to open. In Europe, bukas, sara ang mga schools nila. So this is all a risk, and I don't expect you to have a crystal ball. I commiserate with the difficulty of these decisions. But in opening up, the LGU mayors are very concerned that sila rin, they will be the one to handle the brunt if the virus is not contained, if the children end up to be the spreaders of this disease. So I am simply expressing their concern that yes, they definitely also want the economy to open up dahil hands-on sila eh. Nagpapakain sila, nagsasubsidize sila ng mga walang makain sa walang trabaho ng mga constituents sila. But at the same time, mas takot din silang bumalik tayo sa lockdown. So those are, again, assurances that I think we can afford to give more to them, because if that will be the case, I can only speak for my brother, si Mayor Lino Cayetano, because siya lang naman yung nakakakwentuhan ko, that in Taguig City, they were very willing because they had protocols in place to ensure that stays. So how do you also help the LGUs with this, to our resource persons, no? Kasi mag-open up tayo. And i-connect ko na rin yan para isang tanungan na lang dun sa concern naman ni Senator Gatchalian. I share that concern, no? Students. So, nabanggit Senator Gatchalian and I think Senator Villanueva. Students, teachers, no? How can, and Senator Recto also said it, how can you move on if we don't support education? So we support education, you put the teachers, you vaccinate the teachers, but the students outnumber the teachers. So, paano yun? And they're at the last of the list. No? Those under 16 cannot be vaccinated, and obviously those college age, senior high to college, is at the very bottom of the list. And they make up more than the population of the teachers. And the same thing with the transport sector. There was an appeal to cover the transport sector. I agree with that too. But the population of those in the public vehicles are the passengers. And if they're in the age group of 20 to 40, then they're also at the bottom of the list. So I'm just pointing out these difficulties that I know you face, and any comment on your end is a welcome.
Thank you, Madam Senator and Mr. Chairman. Yesterday, the IATF had agreed to widen the age range to be allowed to enter the malls. From initially it was from 18 to 65, tapos naging in October there was a resolution widening the range to 15 to 65, and yesterday binaba na po natin sa 10 to 65, but only in the MGCQ areas. The matter of applying the same age range of 10 to 65 for the NCR will be subject to an agreement, if arrived at, between the MMDA, the Metro Manila mayors, and the Economic Development Council. A meeting, I think, will happen on Monday. So if they agree, then that will be a policy that will be applied in the NCR as well for children 10 years up to 65 years will be allowed to go to the malls, cognizant of what Secretary Mon Lopez and Secretary Carlo Chua had explained to us, no, why kailangan yung economy, yung mga pamilya, pagka kasama yung bata, mas gumaganda ang lagay ng ekonomiya, ang sales tumataas. Nagpakita po sila ng mga datos patungkol dito na kailangan talaga pahintulutan ang mga bata. Pero sabi nga namin, walang problema sa mga MGCQ areas and other low-risk areas. Pero sa NCR, kailangan mag-meeting muna. So, yun po ang gagawin nila sa Lunes.
Yes, and what I'm saying, Secretary, is that the mayors are in a conundrum also, di ba? On the one hand, I already said it, and I'm basically repeating my point, is that, of course, they want their constituents to be able to earn money and move around, but on the other hand, they're scared of what they see in Europe and in the USA. And, you know, I mean, we know we can't, kung yung US nga, nagkakandara pa, trying to to find room for those in need of intensive care. We don't want that to happen. So it's not a simple question as kung magka-agree. Yun nga, that's the dilemma that they face. They need assurance from the national government that whatever measures have to be put in place to support if there is an increase, it will be there. And I know that UP Octa, which has been regularly doling out data for us, has also expressed that concern, maybe not publicly yet. I just happen to have some conversations with some groups that if we go into that direction, it points to us going into a spike, and are we ready for that? That's what I'm raising to all of you. I'm not saying let's not open up. I'm not saying don't allow the kids out. I'm saying, are we prepared for the consequences? Are we ready to support the LGUs? Because they feel that the brunt is on them. Pagka nag-lockdown, magugutom lalo yung mga tao nila.
Yes, ma'am. I would say that over the past several months, we have been able to ramp up our health system's capacity. Our temporary treatment monitoring facilities have reached, I think, about a little over 11,000 with a consolidated bed count of about 160,000. Our hospitals are now allocating, on the average, both for the public and private, about 26% of their total bed allocation for COVID. So far, the indication is, number one, we have not really seen a significant increase in our critical care utilization rate, at least sa mga hospitals, no? Yung, except for regions 11 and I think CAR, medyo as moderate to high risk na ang kanilang utilization rate. So, ang masasabi ko lang po na pagka ipagpatuloy po ng ating mga kababayan ang pagsunod sa minimum public health standards, ay napaganda po natin ang ating mga datos. Halimbawa, no October 11 last year, we were ranked number 18 among countries with the highest number of cases in absolute terms. So, yun lang bilang nung kaso. Yun lang nung pinagbabasihan, number 18. Today, we're number 32. Your Honor, Mr. Chairman, at pagpapakita po ito na gumaganda po ang pagtugon ng ating mga local government units sa kanila pong response sa COVID-19 pandemic at katuwang po ang national government, of course. At dahil nga po dito na palawig po natin ang testing capacity natin, we're covering at least about 7% of the total population with on the average of a testing daily output reaching about 30 to 35,000 a day. So yung pong lahat ng aspeto ng ating pagtugon mula sa massive prevention measures to early detection na sa ilalim po nito kasama ang active case finding, aggressive contact tracing, testing at ang ating pong aggressive isolation and quarantine. Yan po ay pinalakas natin. Kanya gumanda din po yung per million cases natin. Nasa number 129 po tayo ang rank natin. So we belong to the bottom 50% of those countries with a much lower confirmed cases per million population. Ganun din po, yung case fatality rate natin, it's at 1.9%. We're also, I think, number 76, rank number 76. Tapos yung COVID cases per million, like I said, 130 na pala tayo as of January 17. We have 4,532 cases per million. Samantalang yung po nag-roll out ng kanilang immunization nitong Disyembre ay 5 to 10 times po ang kanilang cases per million population. Kaya sila po ang binigyan ng mga vaccine manufacturing companies ng unang mga bakuna. So yung active cases natin, pang 45 ho tayo, we have 28,674 compared to Malaysia, 37,126, Indonesia, 143,000. So we rank number 45. And then we rank, as I've said, number 32, down from number 18 just last October, last year, no? So what do these data say? It of course says that people have really been more they're following, they're observing the minimum public health standards natin. Mas nasunod, wearing of face masks, face shields, physical distancing. And I'd like to thank all our local chief executives, no, for their very effective implementation of the 5 strategic pillars underpinning our COVID-19 pandemic response. Salamat po.
Noted on that, Secretary. Thank you very much. But I think I'm glad that you had the opportunity to explain that. But I'd also like Secretary Galvez to take note of this and take this up. Sorry, my son's voice in the background. I'd like Secretary Galvez to take this up with the SWD because the concerned secretary, yes, they agree that now they were in a good place in terms of the transmission, the handling of the health sector. But if our COVID infection rate goes up, then what happens after that? And if there will be a lockdown, that's the biggest concern, I believe, especially since they see what's happening in other countries. So that becomes a issue that other sectors, other agencies have to handle. And that's why Secretary Galvez, I'm saying, can you please discuss this with the SWD, with DOF, because the last SAP took 9 months to release. This was after the LGUs were highly criticized on their ability to deliver it to their constituents, which took closely to 3 months, if I'm not mistaken. And then when the SWD handled it, it took 9 months. So yun yung concerns nila. These are valid concerns which I feel should be addressed. And speaking, since I'm on the topic of children going out, I will also resonate the concern of, echo the concern of Senator Gatchalian on when do we talk about schooling, no? I mean, papayagan natin sila mag-Jollibee o parang mag-aral, di ba? Can't we even implement something na 1/3 of the class, 1/4 of the class goes to school para may face-to-face? I leave it up to the experts. I never take it upon myself to make these judgment calls because I'm not the expert. You have the experts. But if they can go out to Jollibee, why shouldn't they be going to school or, you know, even having a one-on-one session with their teacher? So these are things that have to be considered. We can't just think of the economy and not think of the future generation. Secretary Galvez, I just want to be sure that you note that and can discuss that with your team.
Yes, ma'am. Actually, we are talking with DepEd and also CHED on how we could reconfigure schools so that we can have the face-to-face, limited face-to-face. We are working on it, madam, and hopefully, with the coming of the vaccine, we will prioritize the education sector.
10 months na nawalang pasok eh. So, it's really, Mr. Senate President.
Senator Cayetano,
Yes,
can you
yes,
please
ma'am.
wrap up?
We will prioritize your concern, and we will coordinate with our IATF so that we will address your concern. Thank you very much, ma'am, for raising it.
Mr. Chair, I'm sorry, I didn't hear you. Are you saying that my time is up?
Yes, 10 minutes is up. A
Can
minute ago.
I just pose my last
Wrap up.
question and then
Yes.
I will no longer
Wrap
respond.
up, yes.
Yeah, Mr. President, in terms of the, I'm still a little bit confused about the need for tripartite agreements. My understanding was from the President, nobody is being prohibited from purchasing on their own, but I also gather from this hearing now that it would still need to have IATF approval or coordination. I don't really know what. But my specific question on that is to just clarify that, because as we speak, I'll give you a real life example, no? Pwedeng a certain person is covered by their company because their company purchased. But that person also receives a notice from the village association where they live, because the village association was offered by a private company also na may available na vaccines. And then the LGU also offered directly to cover them. So tatlo na yan, no? So will we be in a situation nga na ×3 na nga yung ino-order natin? I don't know. Just pointing it out. If wala yung coordination with the IATF, medyo magkakaroon tayo ng confusion. And what do we do with it? I think that's the thing. You have to have a backup plan. Like maybe you have a literally, figuratively, you have a donation box. Okay, my household effectively got 3 times because I was covered by my employer, by my LGU, and my village association. Maybe pwedeng i-donate yun. I think that's something you have to think about because it will happen. And on that point, the storage of the vaccine, what is circulating now is because 2 to 8 degrees lang ang requirement except for Pfizer, pwede lang daw ilagay sa freezer nila. How, please address that, because it scares me, because from my discussions with the experts, there are redundancies in cold storage facilities that ensure that at no point in time does it go below or above 2 to 8 as opposed to a regular freezer. And God forbid it's a freezer in a city or province that may fluctuation pa ng kuryente. So that really has to be addressed. And my last point, which I direct na lang to Secretary Vince Dizon, because he answered the question on the list of sectors that will be covered. Parang na-cover lang ng other indigent Filipinos yung ating informal sector, yung sari-sari vendor, yung maggugulay. I think, with due respect to the sectors that have the ability to work outdoors na hindi dikit-dikit, I won't name them because ayoko naman sabihin na in-exclude ko sila, but you can imagine there are sectors that the nature of their work is they are outdoors, under the sun, hindi sila dikit-dikit na parang sardina sa MRT. Paano naman yung ating mga vendors? Everyday yan ang sila yung they probably nakikihalimuha sila sa mga 100 tao sa isang araw. So I just wanted to be sure because I didn't see them in the list. And even like the tourists, the informal sectors in the tourists, yung nagbebenta ng kung ano-ano, and literally even massahistas, parang ang hirap naman na others lang sila because I think they're very vital to the stability and improvement of our economy. Thank you, Mr. President, and thank you to our resource person.
Thank you, Senator.
Can I just get a response?
Yes, response from Secretary Vince. Please go ahead.
Yes, ma'am. On the second part of the question, Mr. President, Madam Senator, the workers that were mentioned, particularly the ambulant vendors and others, according to our technical working group, they are actually part of the indigent Filipinos sector, which actually has higher priority even above the essential workers. So they will definitely be covered, ma'am, in the priority sectors. As to the first question, ma'am, we've discussed po with the vaccine cluster and with Secretary Galvez. We will look into the points given by Senator Cayetano po, and we will really look into that. But suffice it to say that everything must be centralized and coordinated through the vaccine cluster of the National Task Force. Thank you, ma'am.
All right, thank you.
Salamat.
Thank you. Just before we go to the second round, and I'm glad that at least we will be finishing early. But just a question running in my mind, Secretary. Perhaps yes, Secretary Gabes, but Secretary Duque and the FDA and HTAC perhaps, or the representatives from Zuilig, Sinopharm, or whoever. The freezing, you've been talking about the freezing point, di ba, yung below zero, the cold storage of the vaccines. There is a time frame, di ba? Parang dapat certain time na dapat nandito siya. All right. My question is this. What happens if you are vaccinated by a vaccine that was not kept in a cold storage facility?
Pwedeng mabawasan ng epekto or mawalan ng epekto.
Pwedeng mawala ng epekto, pwedeng
Mabawasan ng epekto.
mabawasan ng
Yes, sir.
epekto.
Opo.
Pero, hindi, when you say pwede, is there a study made already? Have you researched studies made by these companies that are
Meron
doing
daw po ito, sir, kasi that's why they're very stringent about their demands for strict cold storage temperature. Iba't mga bakuna po, iba't ibang kanilang mga temperature requirement. So yung iba +2, +8 degrees centigrade, yung iba naman -20. I think Moderna is -20 degrees centigrade, while Pfizer is -70 to -80 degrees centigrade. All the rest, the more traditional platforms of inactivated vaccines, no, ay mga +2, +8 degrees centigrade po.
You said pwedeng wala nang epekto, pwedeng may konting effect, no? Pero walang adverse effect.
Mr. President, yun po kasing pag po nag-submit sila ng application, kasama po yung stability study noon, no? Tinesting po nila yan sa oras at saka sa temperature kung kailan siya nawawalan ng visa. So, yun pong pag sinet po yun na 60 by 70, pag nabuksan siya doon, 1 week wala na. Ibig sabihin po na test talaga yon. Useless na po siya, hindi na siya magagamit. At maaari po talagang may adverse events dahil po yung incipient niya o kaya yung mga chemicals na kasama niya, pag na-store sa maling temperature, then maaari po siyang, it can be harmful. Hindi lang po sa nawawalan.
Okay, that's the question na lingering.
Mr. President, hindi lang nasagot yung tanong ko about for them to communicate clearly as to the 2 to 8 requirement, because since pasok yun sa regular freezer, may kumakalat na pwede na yun doon. So when you have these companies or subdivisions ordering, saan mapupunta yun? Mapupunta sa company freezer? Mapupunta ba yun dun sa personal freezer ng isang pamilya na bumili para sa sarili niya, sa mga driver niya? Because yun yung naririnig ko na, okay lang kasi 2 to 8 lang yan, pasok yan sa freezer. And that's why I personally support the need for IATF, NTF coordination in all of this, because this information is going around.
Ms. Jerusalem.
Yes, Your Honor, thank you for giving me the opportunity to answer the question. You're right, ho. The manufacturers really specifies very strict temperature requirements. And if you deviate or you have excursions on those temperatures, the recommendation is the vaccine cannot be used anymore. And it's also already conferred by FDA. Now, talking about the misconception that any freezer can be used to handle the vaccine, our recommendation really is to use the pharma grade facilities. No, pharma grade, as Senator Cayetano mentioned, requires redundancy. So you cannot afford that your freezer will lose power because again, that causes excursion. You cannot be storing the vaccine together with food because that can cause contamination on the vaccine, and then that will also affect the efficacy of the vaccine. Furthermore, it's not only the storage that needs to be considered. You need to make sure that you have processes in place. FDA Director Domingo earlier mentioned that as I guess a pharma company, you need to have the necessary LTOs. Ganun din ho as a warehouser or a warehouse facility for pharma, you actually need to go through the rigorous process of acquiring the LTO from FDA because they come, they audit, they check our processes, they check that our people comply with the process as we've written it, and our facilities are actually really compliant to a pharma standard. So it's not that easy to just convert a facility from agricultural to pharma grade. I hope I was able to answer.
All right, thank you. Yes,
Mr.
I
President,
think it's quite clear. Yeah, again,
Mr. President.
Senator Nancy Bina.
Hindi, just to add lang ho, Mr. President, kasi lumalabas na rin ho sa mga balita, maraming mga LGUs na bumibili na lang sarili nilang mga freezer. Nagko-coordinate ba sila with IATF or with FDA na tama nga itong mga binibili ho nila as part of their handling of the vaccines when it comes?
Ms. Jacqueline?
We are coordinating with some of the LGUs,
Some.
Mr. President. Some ho, hindi ho lahat. Those that have approached us, we actually help and offer training to make sure that their people will be able to handle the vaccine. But really the preference is they have to go through a pharma grade warehouse. We don't subscribe to LGUs opting to do the warehousing themselves. That's a bit worrisome. We spend so much money on the vaccine, baka masayang lang if it's not handled correctly.
Thank you. And siguro, Mr.
Sir.
President, baka maganda na IATF will set a standard
Yes,
pagdating
I was
dito sa
about-
ganitong procurement. Yun lang po,
I
Mr.
was about
President.
to ask Secretary Galvez, will you have some people check on these cold storage facilities that the local government units are putting up?
Sir, actually, sir, we are firming up the supply agreement with the pharma, companies and also with the vaccine companies, so that the supply agreement will ensure that the handover of vaccine from the airport will not break the chain of the required temperature that we had. That's why before the vaccine will be coming here, we will ensure that even on the LGUs that they have established, it should have been accredited as pharma grade. That's why meron po nag-o-offer po sa amin ng mga cold chain with the food. Ang ano po namin is they need accreditation from DOH and also accreditation from the pharma grade supplier po.
All right, thank you. So,
Mr. President.
Senator Risa Ontiveros, you're recognized for your second round, please.
Thank you, Mr. President. Pero dagdag lang po dun sa recent issue, naalala ko rin po ay na previous hearing here, nagsalita po yung Cold Storage Association of the Philippines, and maybe the NTF could bring them together with the LGUs and the pharma companies para mag-join forces to provide that cold storage in every region where the LGUs may be procuring their own vaccine supplies.
Yes, thank you, Mr. Chairman, Mr. President. Yung DOH pa nakikipag-usap na yung aming supply chain doon po sa association ng mga cold storage facility providers, and also direktamente din po nakikiusap doon sa mga bawat mga pharma grade third-party logistics provider. Kasi hindi naman ho pwedeng basta-basta lang na cold storage facility, may standards po. So nakaset na po yung standards ng aming po supply chain management office. So nag-uusap na po.
Salamat po para doon, Secretary. Salamat, Mr. President. So just some follow-up questions kay Sec Galvez from the first round bago ko balikan yung dalawang huling issue na pinark ko for the second round. So, Sec Galvez, just a clarification po. Sabi nyo kanina, and indeed, the countries around the world are rallying to help one another toward that common global interest of ending the pandemic. And this is why nabanggit nyo po na we should set aside our differences for now while we consider the vaccines on offer from China. Gusto ko lang pong i-confirm kung yung Sinovac and the other Chinese vaccine manufacturers have also applied for emergency use authorization in Western developed countries like the US, UK, the EU. In which other countries has Sinovac in particular applied for EUA? And is finally Sinovac part of the WHO's COVAX program?
Sinovac is part of the WHO COVAX. I believe Sir Jimmy Montoya has much information on that. Sinovac.
Yes, Your Honor, Sinovac is actually part of the vaccines that have initially been chosen to be part of the COVAX facility of WHO. Thank you.
As for the EUA, Madam Senator, yung pong submission nila sa amin, ang EUA nila is from China, Argentina, and Indonesia.
Thank you, Dr. Jimmy at saka Director General. Kaya ko po naitanong yan kay Sec kasi sabi mismo ng General Manager ng Sinovac sa isang media interview, hindi na daw sila nag-apply para sa EUA doon sa mga US, UK, EU dahil daw first world countries na daw yung mga yon na kayang gumawa ng sariling vaccine. And strangely, she said na hindi na daw sila sumali sa COVAX. So, hindi ko alam kung alin ang mas updated news, yung sinabi niyang hindi sila sumali or sinabi naman ni Dr. Jimmy kasali sila. Na ang goal ng COVAX ay magkaroon ng bakuna ang mga mahihirap na bansa. So the reason I bring up this follow-up question, Mr. President, Secretary, it seems that the reality is that countries are still prioritizing their national interest. And this is just as it should be. Well, and in the examples kasi ang Sinovac is being marketed towards developing countries like the Philippines, which China wants to include within the orbit of her influence. And China has the right to advance her national interests. Every country does. At tayo din. Kaya ko sinasabing hindi po quid pro quo yung partnering in a COVAX initiative and still equally upholding our interests in the West Philippine Sea. So that's just one follow-up, Sec Galvez. And then a quick follow-up po, have Sinovac and Sinopharm released their test data to the public for peer review?
Madam Senator, they submitted to us non-peer-reviewed and unpublished papers at this time. Kaya sunulatan ko na rin po sila asking them kung ano yung kanilang publication plans, no? What is the strategy, but they haven't replied. So yun pong dalawang nag-submit sa amin ng unpublished data, Gamaleya and Sinovac, we asked them for their publication plans for their data, pero wala pa pong sagot.
Salamat, Director General. Abangan din po namin iyan in order to help raise the vaccine confidence here in
Ma'am,
our
can I
country.
answer on the West Philippines
Yes, Sec.
issue?
Mr. President.
The ITF focus and our focus is more on saving lives. The political direction on the West Philippine Sea, it is distinct from our effort on health. So maybe we can have the DFA answering the issue, considering they also the one receiving also the diplomatic arrangement with China.
Thank you, Sec.
Thank you very much, Honorable Chair, Honorable Senators. Allow me to convey the assurances that our transactions on vaccine supply with global partners at the bilateral and multilateral levels do not have strings attached or bearing any quid pro quo of any sovereign territorial consideration. We can assure that in the particular case of the donation from China, at no time did the China side even hint at tying the vaccine donation to any consideration. Vaccine diplomacy would at best be an expression of goodwill and solidarity with the Philippines during this time of the pandemic. It may be noted that the COVAX facility itself is some form of a donation mechanism to benefit lower and middle income countries. Thank you for this opportunity to provide additional assurances and to dispel any doubts on the matter, Your Honors. Thank you.
Thank you, ASEC Tamayo. Thank you, Mr. President. And SEC as well. dahil strategic interest ito pati sa West Philippine Sea, pero urgent yung ating COVID-19 engagement ngayon. So napaka-sensitive ng publiko din from statements from the NTF itself, at nakakatulong kapag yung in-express ngayon ng DFA are carried as well, no, equally sa NTF, yung no strings attached, no quid pro quo. Since sinabi nga po ni DG Domingo na non-peer reviewed, no, so